Today on Cityline, it's Makeover Madness. Bill Rowley hits the ice with tips for your winter hair.
Moisturize, moisturize, moisturize. And maybe learn how to skate.
While Dino tackles chapped lips, we take a look at a post-baby tummy tuck. Plus, Dave Lackey brings us his spring beauty picks. And wait till you see these transformations. Right now on Cityline.
Amanda was feeling a little self-conscious about her post-pregnancy body, so Dr. Mulholland gave her a new mommy makeover. Take a look.
Have a seat and relax. So, pleasant young lady, you've had a baby now. How old is your child?
She's 3.
3 years old. Breast augmentation is extremely common. It's number 2 right after liposuction. As women nowadays are entering into their postpartum years, they've had their kids, they are healthier than they've ever been. They diet, they exercise, Pilates, yoga, but they look in the mirror and what they can't bring back is what babies and breastfeeding took away. Before you had children, you had a fuller upper pole of your breast,
Absolutely.
a little perky. You're always smallish, but you always had a perky, fuller breast.
Exactly, yeah. I'm so used to having like a tight little figure to you and really not having to work too hard at it. I didn't feel as sexy, I didn't feel as desirable anymore, and that did a lot to me.
So would you agree that's the area that's been frustrating on the front?
Absolutely, yeah.
She's worked out like a fiend. She's exercised for 3 years. She's down to her ideal body weight, and she has a nice figure, but she's bothered by a little pot and some love handles around the sides. So the most important principle of lipo today is get reciprocal contraction of the skin with removal of the fat. So you have a thinner contour, but you don't make a granny tummy. You want to make a youthful tummy, which should have tight, smooth skin. For the breast, obviously if you've lost the volume, you're not going to be able to get it back. There's no magic pill of breast augmentation. But breast augment surgery's changed significantly in that you can choose a shape, either teardrop or round, and a size that fits you. And we do that through a special imaging machine called the Vectra 3D. Nowadays, the telltale signs, which are visible incisions, we give lots of options to patients. Often under the breast has turned out to be one of the best approaches. It's become a very safe operation. It usually performed in under an hour, not even under general anesthesia, like twilight sedation, like having a colonoscopy or having a dental wisdom tooth extraction. It's good to see you again. How many months is it now?
It's been 4 months.
4 or 5 months, okay, great. So are you happy?
I'm so happy.
Great.
Ecstatic. I completely refound myself, and people have noticed a change, especially in my personality, my sense of humor, my overall being has changed since having this done.
She hit the nail on the head there, Amanda, at the end when she says people have noticed the change, but you notice she said in my personality. So a lot of people will look at her and say, okay, her body was already great. Why is she getting anything done? But sometimes it's a psychological thing. It's not always a physical thing.
Yeah, she didn't have a huge change in her figure.
Yeah.
A little bit of fat reduction, skin tightening, and a small augmentation. And if you didn't know her, you would know because she's wearing push-up underwire bras and wearing support Spanx.
Right.
But now she could wear what she wanted, tank top or an evening gown, feel sexy again. And the biggest change was in her perspective, in her perception, and how she carried herself.
Right, okay. So a lot of people will be at different stages with their body after they've had a baby. Some people will be the Amandas of the world. Some people will have, have put on a lot more weight. Hello, 60 pounds if you're me. Do you wait until you have had all of your kids before you look into a new mommy makeover?
It's a great question. I mean, Amanda is the one side of the mommy makeover, what I call the mommy mini, where she's had one child out of a relationship, not sure she's going to get married again or have kids. She's in her mid to late 20s, has a few frustrating changes. She has an operation that takes an hour and 15 minutes, does it on a Thursday, back on a Monday, That's for the mommy minis. Now, if you've had 2 or 3 kids or you're planning 2 or 3 kids, and there's a lot of changes, loose skin, breast deflation, then you're probably best to wait, because if you have more kids, it may alter your surgery, and that would be more the mommy major, which would be the typical tummy tuck, the body tight type of lipo, and some breast surgery, so some breastwork, lipo, and removal of skin. And usually that mommy major is best to wait until the end of the kids to do that.
Okay, all right. Now, we've got some examples of people who have gone through bigger transformations as well. And these are also mommy makeovers, but these would be more of the major
That would be. So this
makeovers.
lady's got a lot of loose skin. Her muscles are weak. She's put on, had 3 or 4 kids. That's really a 3-week recovery. It's a huge change.
Yeah.
And she waited to the end of her childbearing cycle. But there's so many different types of women now in relationships that to force them to wait till they're 40 or 45 means their entire late 20s and 30s may they not feel as sexy as they want to.
Right, so you advise maybe stick with a mini if you're thinking maybe you're going to have a few more kids. So here's another really drastic change here. Same woman.
Yep, a lot of kids, a lot of loose skin, diet and exercise. And again, now she needs the help of plastic surgery to take where diet and exercise got her. She lost a lot of weight, but
Right.
that's just all loose skin. That's courtesy of 3 or 4 children. The children are great, but they sometimes leave devastation behind them. Yeah.
Yes, they do. Okay, let's talk a little bit about procedures. There are some that are more invasive than others. What are some of the options out there when it comes to the tummy tucks and the
Right.
breast augmentations?
So Amanda was on the mini side, and generally with modest loose skin, a little bit of fat, we have products like that Body Tight that you saw moving back and forth. It removes fat and tightens at the same time, but no big incision. And so you could do your procedure on a Thursday, be back to work on a Monday without much downtime.
Okay.
Breast surgery's changed totally. Most women are always afraid, geez, I wonder if I pick the wrong size. With that new Vectra imaging, 3D imaging, it's like going to Holt Renfrew. You see a number of dresses, you think, that's going to look good on me. You try it on, and it sucks.
Right.
So you have to try on a bunch of dresses. Now with the implants, it's the same. You can pick a bunch and pick what fits your sense of sexy. She chose a very small implant. It was a 45-minute procedure, and it gave her that little bit of upper pole loss that breastfeeding took away from her, and no amount of diet and exercise is going to bring that back.
So how does that work then, this vector system? Is it just a computer imaging?
Yeah, it's a computer imaging based upon a lot of software data. So we take a bunch of points, the computer does immediately, and based upon a bunch of before and afters can predict very, very quickly what you're going to look like. So it's like watching Dexter season 8, and you have a person's face, you want to know what they're going to look like, a year later or 10 years later. The software will do that for you.
Okay.
It's very cool because it removes the biggest fear.
You can try on boobies,
Yeah,
is what
you can try
do.
on breasts, like trying
and
on a
figure
dress.
out which ones you want. What are the, if there are any, risks, and who might be the best candidates for this sort of these sort of procedures?
It's very important to remember this is not non-invasive stuff. There are risks, anything from major to minor risks of any surgery. So it's important that the surgeon spends time going over those risks. They're very rare. But someone needs to be prepared to accept the pain and discomfort of surgery.
Yeah.
The mini, you can sort of be back to work feeling uncomfortable in 3 days. With the more mommy major, the tummy tuck, the Body Tight, the breast work, you really need about 3 weeks off, and that's a big commitment.
Right.
So the risks are acceptable, but they're not negligible or irrelevant. So a good candidate understands the risks and the benefits. They know what they want to achieve. They come in, they get some imaging. We know that their expectations are realistic, and that's the biggest risk, that someone's expectations are here and the outcome's there. I do a good job, they look great, but they wanted to meet Brad Pitt. Well, that may not happen.
Yeah, and I mean, the good thing now is that you have technology to back up what they're going to look like, and I think that really does good in terms of keeping expectations where they should be.
Correct, yes.
Okay.
So.
Dr. Mulholland has brought everyone in today's audience a $250 Spa Medica gift certificate and Vivier Skin Serum 10. So it's an oil-free, medical-grade serum that helps reduce the signs of environmental damage, such as fine lines and wrinkles and uneven skin texture. Thanks so much for that, Steve.
Well.
Let's go to break. We've got more coming up. Stay with us.